Terry Stewart. We're just wondering whether you could see us okay. We might be a little bit reflective. We've tried to get a light on our faces. Hopefully that's okay. We might just turn this down a little bit. How's that? That looks a bit better, isn't it, Terry? Okay, so I'm here today with Terry. Terry's an osteopath in Wollongong, and he's got a wealth of experience in pain management. And he has gone and done a master's degree in pain management. What was the actual name of the degree that you did, Terry?
It was at Sydney University. It's called a Master's in Science Medicine in Pain Management, and It's a postgraduate master's, so it's 2 years.
Right, wow, that's amazing. And so you obviously learned a lot through that process, Terry. If you've just joined us, I'm just talking to Terry Stewart, osteopath, and we're talking about pain. So settle in, we're just going to have a good discussion just to help you guys out about some definitions around it. There's a lot of history in pain, and there's a lot of history between different practitioners and how we've grown as a profession, I guess. And pain is a term that's used very loosely and also very colloquially. Wow, I got that word out, that's good. So Terry, just tell me a little bit about what definition you use about pain and around how you talk with your patients.
One of the most important things when we talk about pain is to explain to any patient, whether it's with a physio, osteo, or any sort of physical therapist or doctor, is that pain's a normal process that is produced by the brain, and it's to protect us. So without that, we wouldn't know what was going on in our body or if there's a threat to any tissues. Yeah. So it's really normal. So we don't want to demonise pain. We want to actually help people understand that it's okay. Yes,
absolutely. Yeah. And I think sometimes we see all these fads out there of do this, do that, get rid of your pain, do this. And we as well will often get a patient in with very acute pain, and they will often ask us, oh, should I take some medication before I come and see you? And it's one of those questions of, oh, do I need to make sure my pain is real when I come to see you? Which makes me laugh a little bit, because we often, as like yourself, we look a lot at dysfunction as well. So
that's right,
pain's a symptom, and what's underlying and what's causing is more what we're searching for. But you're quite right, pain is something that's very real, and it's there to help warn us, it's helped to guide us in how we should move and what we should do in our lives. So Terry, one of the big fallacies that probably went through in the times before my age, maybe not before yours.
Yeah, I'm an old fella.
But was just go to bed. Just go to bed. Like, serious? What's that about?
Yeah, it's in that respect, Kat's just trying to improve our lighting here. Unfortunately, we've got lights on and everything, but look, we've got this. You know?
Oh, is that any better? Maybe it's better you can't see us. Okay, there we go, Terry.
So, one of the most important things is not to create fear around pain. So just because you have pain, don't move and rest. That's actually one of the worst things that you can probably do, as Kat said. So what's really important is that we keep moving despite our pain, but at the same time we need to understand, we need to listen to our pain. So it's a balance around pacing, and it depends whether it's acute or it's persistent, or what's actually happening in each individual case. So we can't blanket everybody with the same type of advice.
Yeah.
We have to be very individualised.
Yeah. So then, obviously, lots of people hear terms like acute and chronic pain. What are they about?
Acute pain usually is a very recent onset, so you might sprain an ankle or strain a hamstring or something like that. And then the pain is there to actually help you to understand. Please don't do too much, because you might actually cause more tissue problems or damage. We need to include inflammation in that too, because inflammation is actually a really good process.
Yeah.
We shouldn't actually think that it's bad.
Yes.
If there's heaps of it, of course it can be more of a problem. But inflammation sensitizes your nervous system, as well as promoting recovery through all the white blood cells and the things that are actually through the swelling.
Yeah.
So it promotes recovery, but it will make you sorer so that you won't walk on that ankle as much. But as you recover, then gradually that inflammation and pain will sort of resolve. Something that pain doesn't always mean injury either. So if you're sitting at your computer all day, and then you're slouching and you're putting a load through tissues, you'll actually develop what we call ischemia in tissues.
Yeah, okay.
In other words, reduced fluid flow in and out, so blood flow and lymphatics and things, and you'll build up acids.
Yeah.
And that will ache and it will hurt. That's actually not tissue injury. It's actually telling you, please move, I'm not happy with what's going on. If you keep going, maybe there will be an injury of some description.
So it's a lot of feedback, isn't it, to your body? Hi, Leslie. How are you going? Thanks for joining us. And if you have just joined us, we're talking to Terry Stewart, osteo extraordinaire, and we're talking about acute versus chronic pain. So, you know, there's a lot of systems in our body, and it is quite complicated.
Yeah.
And I think you're quite right. It's people, don't be fearful of it.
Yeah.
Like, get some advice around it, and don't, you know, if you're worried about what you should or shouldn't do, ask. Like, don't just try and fondle around in the dark, because there's a lot of information now that we can guide relatively well on what type of pain we are getting.
I think we've got a big responsibility as practitioners to not help people develop fears or the wrong thought processes around what's going on. We have a massive responsibility.
Absolutely.
We're in a very powerful position because people tend to believe our advice. They're paying to come and see us. They want pain relief. The last thing we want to do is perpetuate their pain.
Absolutely.
And turn it into a persistent pain scenario, which happens often.
Yeah.
Well, probably more often than we would like.
That's right.
Yeah.
Another factor around pain is, and we in the Illawarra are very lucky. We live in a very multicultural society, for want of a better word. We're very fortunate in that way. We have a lot of different cultures around us, and pain can present very differently, can't it, in different cultures?
It's a really interesting point, and it's cultures, socio-economic sort of areas that there's a lot of research. And during the Masters, this was a really a significant point that we learn about is that some people in various cultures actually learned that they should not even recognise their pain, that they just totally cope with it.
Like a stiff upper lip.
That's right.
Yep.
And even in some of our Islamic cultures and things like that, particularly in the female side of it, that they just put up with things, or it's part of the culture. It's not it's not necessarily a bad thing, but that's just the cultural differences that there are. Yeah. And then you've got your own life and what experiences you've had with pain and how that impacts on you as you grow.
Yes.
Like if you're a child and you ran to mummy with a scraped knee and she gave you a big cuddle and then you cried, that makes pain more significant.
Yes.
But if the child runs to you and then you pat him on the backside and say, off you go, then your child's going to grow up with a very different attitude about how to deal and cope with pain.
That's right. And I guess for us as practitioners, there's not a right or wrong about that.
No. It's
for us to recognise how you as individuals do express your pain, so that we know how to then progress you through what's happening. So don't feel that this is a right or wrong situation.
No.
It's very much about trying to get a global picture of what pain is for you and how that fits into the picture that you're coming to us with.
As Kat said, this is where it's important for us as practitioners to ask you questions about what happened, your experiences with pain, and try and delve a little bit deeper in a really nice, positive way so that we can get a better picture about who you are and how you're coping with your pain.
So Terry, tell me a little bit about different areas. So you touched earlier on acute things like hamstring injury, ankle injury. What about backs? Because backs are something that there's a lot of research around on. Sorry, I'm just going to do that, see if that helps us a little bit. Backs are one of those things that there's a lot of dollars that go into it in our health funds, in our healthcare system. I know employers would find that's a big part of what can sometimes, come up in the workplace. How do they manage that? Backs, it's a massive thing in our society. And we've obviously come into this computer age where we do a lot of sitting. Our lifestyles are very different to our parents' generation, where I guess a lot of their backs were due to too much work.
Yeah.
But what's your take on backs at the moment, and some stats around it, or things that will help people?
Yeah, everyone's going to experience pain in their life, but low back pain is one of the things that we most commonly see. And then maybe neck pain now is becoming a little bit more prevalent because of computer-seated postures.
Yeah.
But a nice term around that is simple mechanical low back pain.
Yes, okay.
Most pain that we experience, it has no traumatic onset. It just develops over time. It could be the joints of the body might come a little bit irritated, the muscles, or a combination.
Yeah.
So, and if you're sitting at a computer all day or bending forward each day, then that pain's really normal.
Yes.
You're getting signals to say that, okay, we're a bit tired here, and now they're being loaded up. So this is where a conditioning issue is also part of the whole thing.
Yeah.
Is that how strong are you?
Yes.
How can you cope with your daily job or responsibilities?
Yeah.
So then you come and see Kat, who helps you with a rehab program, and then your pain.
Yeah.
Look, the best advice we can give people is that if you keep moving, most back pain resolves within a couple of weeks.
Yeah.
Even
yeah.
without treatment.
Yeah. Yeah.
Treatment is a bit of a bonus because we
Yeah.
get the opportunity to help educate you.
And that's right. I think what treatment. Hi, if you've just joined us, this is Terry Stewart, osteopath extraordinaire in Wollongong. We're just talking about pain, chronic pain, and acute pain, and at the moment is specifically back pain. I just got that out.
Easy for you to say.
You're quite right, but I think what we both try and do is try and decrease the risk factor of it happening again.
Yeah, that's
and trying to educate to say, you know, there's a massive number, about 95% of population will have an episode of back pain in their life.
Yeah.
And how that is quantified depends on who's doing the research. But around that, we really try and arm people with some tools so that if they if they are going to have another episode, it's a lot less and not as long, but B, that they're just really going to try and avoid having that downtime again because of the back.
Yeah, and one of the most important strategies around that is to help people self-manage. So that, once again, the advice that we can provide you, that you need to take that away, but you need to be really compliant about what you've been advised to do.
Yeah.
So if there's identified, if you come and see Kat, and then she says, okay, we found there's some weaknesses here, some strengths here, tightness, then the post-treatment advice that you get in terms of rehab, you need to be doing those things.
Absolutely.
And so once you walk out of that door, we can't help you.
That's right.
You have to help yourself.
So just a big call out to someone I was speaking to this morning who said, why can't they just lay thy hands and get me better? Look, we can both get you to a point. We can definitely do that. We can definitely release things off and make you feel nice and happy. But at the end of the day, that's not going to give you strength, and it's not going to give you the release and control that you need around this area.
Passive treatment approaches and a reliance on that is not a good thing, because then you will always come back to us and say, take this pain away, when the essence of it is that you need to actually manage yourself.
How are we going to have a coffee? Like, seriously,
Yeah.
if all we're doing is treating you guys?
That's right.
Like, gosh, you know.
At least 2 coffees a day.
So, Terry, you run a program around pain management in the Illawarra, and this is something that's been going for 2 years now. Would that be correct?
Yeah, I've been working within pain management programs for about 8 years, but we've been developing ours over the last couple of years.
Yeah, so that's a fantastic resource to have in the Illawarra. Do you want to tell us a little bit about how it runs, who's involved, and why it works?
So, we've talked about acute pain, we've talked about various things around that, about, you know, like low back pain, things like that. Persistent pain's a totally different scenario here. That acute pain has a purpose and a use, and it has a value because it helps us recover. Persistent pain is a good way to think of it. You may have heard that it's pain more than 3 months, and maybe that's so, but we like to think of it more that pain that hasn't responded to things that are known to actually help.
So 3 months is that the mark you look at?
It's a mark that probably it's really quantitative in that sense, that insurers, various
and a lot goes around that, doesn't it?
Yeah. So, but if it's not responding to treatment that should be responding to, or it's past tissue healing time that we know it should have recovered, then...
And it doesn't have to be completely better at 3 months.
That's right.
It's, as long as you are improving, you're getting a change. Yeah?
You can have subacute episodes, you can exacerbate things, and that's quite normal. With persistent pain, one of the major problems is that, as we say, the issue isn't in the tissue. It now is your nervous system and your brain that plays the primary role here. So your nervous system becomes really sensitive. You can actually have DNA changes within the nerves that are signalling to the brain. They're called nociceptors. So their specific job is to say, okay, there's a problem in the tissue. But they can change, and instead of firing off up here at a 10, they can actually start to fire off at a 2. So you're getting pain at a low threshold, very little movement.
And so just to quantify how we talk pain. Hi, if you just joined us, this is Terry Stewart. He's an osteopath talking about persistent pain in the program these guys run. We're just quantifying around 0 to 10. We talk these numbers. It's a scale that we try and use to quantify your pain. So Terry's 4 would probably only be a 1 for me. But it's about, so 0 is no pain, 10's off to hospital, can't walk, can't do anything. So, and Terry's sort of talking about that now. So
that's what we call, it's a score out of 10 that we can actually, it's not a real accurate thing in a way, but so we can monitor what you believe your pain levels are, not what we think.
Yeah.
But sorry, in that instance, Kat, I was using an example that if your nervous system threshold was 10,
yes,
now it's down to 2 as well. So it's really, it's firing when it shouldn't in a sense.
Yeah.
But so people might start to think, oh, I've hurt something again.
Yeah.
So then you might start to avoid activity again, thinking that you don't want to hurt yourself.
Yes.
But now this guy up here, the brain starts to become way too involved because all these changes are happening in your brain.
Yeah.
And now emotional issues and psychological issues, anxiety, fear can actually start to impact really significantly on pain.
Interesting you say that. I went to a lecture series a little while ago, and this is quite an interesting story, and it was someone who's quite prominent within the pain area, and he was out bushwalking, and he...
Laura Mosley.
Oh, shh. Anyway.
Sorry.
No names.
I didn't say that.
And he actually was bushwalking and he got bitten by a snake.
A brown snake, yeah.
And he didn't think he was bitten, and he obviously then became quite sick and had to get help and all the rest of it. And then probably 12 months later he went back out and walked, and a twig got him on the leg. And now this is someone who is extremely well educated and knowledgeable, and lectures and teaches, and this is his world. He breathes and lives.
Yeah, that's right.
How the brain and pain work. And he said, I had this reaction that was like I'd been bitten by a brown snake again. He said, no.
He described that searing pain up his leg.
Yeah.
To what Kat's talking about, the initial, he brushed what his brain thought was a twig, so the nerves fired off, but because he'd done that all through his life, his brain just thought, oh, he's okay, it's just a twig.
Yeah.
But it was actually a brown snake.
That's right.
And it's funny because once he touched a twig a year later, the opposite thing happened. His brain says, oh, I remember that. You know what, he died last time. So it gave him this massive amount of pain.
So he could go and make sure he didn't die and get some help.
So people may have heard of the term called neuroplasticity.
Yes, yes. I think this is a big thing in the media at the moment, Terry, so it's worthwhile talking about.
So neuroplasticity simply means that your nervous system, your brain, can change and learn. So it's a really useful and valuable thing. In persistent pain, it's not. The neuroplasticity in your persistent pain is not helpful.
That's right.
But if you have a baby that is crawling along, every time it lifts its head, it actually is creating a signal to your brain, and your brain is going, oh, okay, new movement. And every time the child does that, the recruiting of all those nerves and muscles is strengthened.
Yeah.
So then they can hold their head up. So the neuroplasticity is a really good thing. It helps us to grow and learn and to actually strengthen many different things.
Yeah. So just coming back to your course, how does it work? That's all right, we digress. Hi, if you've just joined us, we're talking to Terry Stewart, osteopath, and we're talking about pain. So it's a massive area, and we're just trying to touch on a few things that might help you today. And Terry runs a pain program, a persistent pain program here in the Illawarra. It's a fantastic program. So how does it run? Who's involved?
So we run it over 12 weeks. It's people that have tried a lot of different things, a lot of different interventions. They might have had pain for 12 months or 12 years. And so what we do is when people are referred here, it's run over 12 weeks. We have a psychologist and an exercise physiologist.
Fantastic, yeah.
So we educate people, help them to understand what pain is, why it persists, what things change. And we try to identify for people in each individual case and as a group, why is pain persisting, what's impacting on their individual case. And then to help them understand what their role in their recovery is. So giving them the skills to self-manage. It doesn't mean they will be pain-free. But hopefully what we achieve at the end of the 12 weeks is that people are more comfortable that they're okay. If we can simply help people to understand that you're okay, you're quite safe, but you have this pain that is persisting, people will tend to start to resume as normal life as they can, some more than others. And from there we can monitor, we can back up. Our psychologist offers services after as well. And when you've tried so much manual therapy and it hasn't worked, it's failure.
Absolutely.
And so to keep going back to that failure creates a lot of distress for people.
Of course it would.
And so
especially if they're thinking they're doing the right thing because they're being referred back. So, you know, they're thinking they're doing the right stuff, but there's obviously another layer to it.
And many practitioners will think that they're doing the right thing by trying to help someone with... And as an osteopath in my postgraduate studies, I have to say that I was one of those guys.
Of course, we've all been there, haven't
I
we?
treated people, I thought I was helping them, but in essence, really, I probably wasn't.
Yeah.
And after studying, you just sort of think, okay, there's a lot of other ways.
That's right.
It doesn't mean you can't treat.
Yes.
But you have to make your patient aware that you're not the answer.
Absolutely.
Yeah.
Absolutely. And you touched on that earlier about the ownership away from us. And we even talk to our athletes about that, you know, our swimmers, it's sure you get in the pool and do what you do here, but if you're not doing all that stuff at home, of your recovery and eating well and maintaining your body, you're never going to perform as well as you can in the pool. So it's very similar. I think it's amazing that we've got this program in the Illawarra. If someone felt that they would like to come to it, or if they know someone who might benefit from it, what happens? How do they get involved?
Well, Kat's loaded a brochure on for you that we're called Effective Pain Solutions, and so that's us there, and we've got heaps of information there within that brochure. Sale of the Century Girl here. And so if you contact Heidi at Body Dynamics, who is our exercise physiologist, and I work at the same place as Heidi, so
do we have the details? Oh, the
details are on there.
The details are on the back here. But if you type below here, just type in PAIN, P-A-I-N, and this brochure will come to you. You just need to answer some questions on the way through, and you'll get this brochure and you can download it, so you'll have all that information. So
we can then talk to you about what's going on. We see people who have insurance, work cover type of injuries and things, or we see members of the public. There's fees associated with that, but we try and keep them as manageable and as, you know, like cheap for people as we can. And the strength is also in a group where you have a lot of people. There's a lot of empathy within the group that people feel like they're not alone.
Yes,
because someone else is actually going through what I'm going through.
Yeah.
And one of the really important things for anybody with persistent pain as a practitioner is we need to validate their pain. In other words, we just should believe them. It's people seem like they're over sort of stressing and they're exaggerating their pain. Yeah. We don't know how they feel.
That's right.
And there's many other factors that are causing that exaggeration, if you want to call it that.
And I think sometimes too, people can feel quite alone if their family members don't understand their pain as well.
When it's very close that people, you know, to put it plainly, that people get sick of hearing that, oh, I'm in pain.
Yeah.
And so the family becomes quite immune and even unsympathetic to some degree.
Yes.
And all of this is normal. It's no one's fault.
Yeah.
So there's no blame here.
No, that's right. Absolutely.
It's about how do we move forward. And we can educate families as well as part of the program.
Fantastic, Terry. So guys, if you want some information on that, type in PAIN down in the comments and the brochure will come through to you. Look, I really recommend it. I've had some not me personally, but I have had some colleagues do the course that have found it fantastic. They've got some really good results out of it. Terry and Heidi and John, fantastic. They are salt of the earth. They're in it for absolutely the right reasons. They're very, very knowledgeable. They keep up to date, and Terry's a bit of my go-to when I need big words explained in pain. We've tried to not dumb it down, that's a silly thing to say. Well, he needed to for me today. But seriously, if you know anyone who needs some help in persistent pain management, these are the guys to get in contact with. So, Terry, thank you so much for being on the couch with me today. And any questions, also just type down below, reach out. We're here to help and hopefully help you guys get back on track.
Take care, everyone.
Thanks, guys.
Thanks for listening. Really appreciate it.
Bye.